thank you all for coming out here today to cover an issue that has obviously been around the globe for quite some time, but it's visiting the United States in a much higher sense of urgency right now. And like everybody else, we're following the news report about the spread of COVID-19 around the world, and we all feel both a high level of concern and a high level of compassion for the people who've been impacted by this disease. And it's only natural, obviously, for people to be thinking here in this country and in this state and in our city, okay, what does this mean for me? What kind of preparation are we undertaking here in Louisville? And how can we be ready to go? So first off, let's take a look at the facts. There have been no cases of COVID-19 in Louisville, in Kentucky, or in Indiana. So let's be really clear on that. Again, there have been no cases in Kentucky or Indiana. It does not mean there can not be some in the future, but there have been none to date right now. Also, when you think about how this disease is spreading, and oftentimes by travel, people flying in and out of airports, I want to emphasize that Louisville International Muhammad Ali Airport is not a place where travelers are arriving directly from other countries. And so we are not a port of entry for international travelers, so that gives us one level of separation. That means people who land at our airport have already been screened for COVID-19 in other places. Also, businesses and institutions such as UPS and the University of Louisville all have travel protocols in place for employees and students involved in international travel. So we will continue to welcome visitors to our city as we have in the past. Our partners at Louisville Tourism say that all of the conventions planned for this spring and summer are still happening, and we're moving ahead with the big events that we've got planned up for the weeks ahead here as we welcome spring, Thunder over Louisville, the Kentucky Derby Festival, and of course Kentucky Derby 146, which is running on Saturday, May the 2nd. And that is just 64 days from now, as John Asher would have reminded us. So the bottom line at this point is that Kentuckians continue to be at very low risk from COVID-19. This is a message that the governor will be sharing later today when he does a press event for addressing this issue for the entire Commonwealth. So that doesn't mean we're not going to be alert. I want to emphasize that as well. And right now, as Dr. Moyer will explain in a moment, the seasonal flu, which we deal with every year, actually poses a much, much bigger threat to us than the coronavirus. That said, the situation with COVID-19 is evolving, and we are in contact with the CDC, the Department of Health and Human Services, at the Kentucky Department for Public Health. And so we will be prepared to address this disease as needed if, in fact, that comes up. I'm confident in saying that because while concern over coronavirus is new, preparing for emergencies and disasters and potential threats is part of the DNA at Metro government. It's what we practice on. It's what we have executed on in the past as well. Our team knows how to work together across agencies and with community partners to protect the health and safety of all of our citizens. As a resilient city, we've spent years studying best practices and preparing for potential crises of all kinds, planning and conducting simulations and exercises so we're equipped to respond to all types of threats. We've established protocols specifically to deal with outbreaks, pandemics, and other community emergencies, and our ability to respond to outbreaks of communicable disease has been tested in the last few years. Remember the hepatitis A outbreak of 2017. The CDC called our city's response the gold standard. I was very proud of the way our team responded there and how we contained hepatitis A with national recognition. Metro government dealt successfully with the 2009 H1N1 pandemic when we administered more than 22,000 immunizations over 2 days at drive-through and walk-in clinics. We were also ready and prepared to address Ebola and the Zika viruses should they have come to our city. And so we approach all these things with knowledge about what the medical protocols are, the public health protocols are, and with the compassion people would expect for our city. So obviously we're going to continue to monitor this situation closely, see how it evolves. While we're confident, we do want to say we will throw everything at this if this comes into our region so that we make sure that every resource that we have is marshaled against this possibility. And we will communicate heavily and frequently to the people of Louisville in this region if, in fact, the coronavirus does come to this area. And also, I really appreciate the good media coverage of this here today. So I want to say to the media that we're counting on you all, our local media, to help people understand what is happening here and what is not. This is something that's easy to sensationalize. People get very concerned very quickly. So we ask you all to be balanced in your reporting of the issues around the coronavirus. So we want people to be aware and prepared, but we don't want them to be unnecessarily scared. So please help us in that endeavor. Now I'd like to bring up Dr. Sarah Moyer. She's our Chief Health Strategist and Director for the Department of Public Health and Wellness. Dr. Moyer?
So first, just want to reiterate what Mayor Fischer just said. There's no COVID-19 cases in Louisville or in Kentucky, and the risk to our people in our city remains low. Presently, there's 60 confirmed cases in the U.S., 15 were detected through public health surveillance, and 45 detected among those that came back from the Hubei, China, and the Diamond Princess cruise. Last night, the CDC announced an infection with the virus that causes COVID-19 in a California person who reportedly did not have relevant travel history or exposure to another patient with COVID-19. It's possible that this could have been an instance of community spread, which would be the first time that this has happened in the United States. Community spread means spread of an illness for which the source of infection is unknown. It's also possible, however, that the patient may have been exposed to a returned traveler who was also infected. I'm confident that the CDC will get to the bottom of this. But this new case underscores the importance of being ready to respond to COVID-19 in Louisville, and we are ready. Preparing for outbreaks is embedded in public health in all levels of government. Standing behind me today are several members of my team, our medical director, Dr. Lori Kaloya, our director of public health preparedness, Paul Kern, and our chief epidemiologist and director of our communicable disease program, Ray Zhao. They represent many other public health employees who work daily to keep our community safe. Every day we are monitoring and tracking diseases in our community. In fact, law requires local physicians to report more than 30 different communicable diseases to us. We have a division of public health preparedness who works year-round with a host of partners to plan, drill, simulate, and prepare for how we respond to emergencies and disasters. We've already activated our emergency response team that work diligently with our community to bring hepatitis A under control. And we're in regular communications with the CDC, as well as our state and local partners, including local hospital systems, healthcare providers. We've been meeting with JCPS, U of L, other local colleges and universities, and also our business partners. So let me remind everyone, in Louisville, right now, we are at far greater risk from the flu than we are from COVID-19. This year, we've had more than 7,600 confirmed flu cases and 8 deaths, and that's just in Louisville. And while there is a vaccine to protect against the flu, there's no vaccine yet to protect against COVID-19. But there's some simple and effective things that you can do every day to protect yourself and others from the germs and viruses that lead to both of these illnesses. So wash your hands frequently, sneeze and cough into your elbow or tissue, and then immediately throw the tissues away. And if you're sick, stay home. So let me address the issue facing masks regarding COVID-19. The CDC does not recommend the use of masks to prevent respiratory disease. Face masks prevent people already infected from spreading disease to others, so they do not prevent uninfected people from becoming sick. Even masks designed for healthcare workers must be individually fitted to the person wearing them in order to be effective. So there's a lot of unnecessary fear and panic around coronavirus and COVID-19 right now. Images and headlines you see in social media and mainstream news media can be frightening. It is a serious issue, and it's important that we all stay informed. It's also important that we can prepare today and every day for emergencies. We all have a part to play. So I encourage you to visit CDC's and the World Health Organization's websites for the most up-to-date information, including checklists to help individuals, workplaces, event planners, healthcare providers. They can all help us plan and prepare against spreading respiratory illness. So just like we did for the H1N1 flu in 2019, hepatitis A, and just flu in general, we promise to keep you informed of any new developments. So thank you. And that's it. Mayor, any more? Any questions? Yes.
Could you elaborate on the people who are self-monitoring right now? Who are they, how many, and why they are doing this?
Yes, we are monitoring anyone who's traveled to countries that CDC has decided that where COVID-19 is widespread. Right now, we have about 10 that we are still monitoring for the 2 weeks that we call it the incubation period, where the disease could pop up if they're not currently symptomatic.
And how many again?
About 10 currently.
Was the number much higher?
Yes, there's been, once people have been here for 2 weeks and there's no chance of the disease developing, then we stop monitoring.
And when they agree to be self-monitored, what does that mean? What are they doing? Are they self-quarantined in their home? How does that work?
Yeah, they're in their home, not interacting with other people, and they're taking their temperatures for us and monitoring for symptoms.
For 2 weeks?
For 2 weeks, yeah.
And do they have to sign anything to agree to do that?
Yes.
They also have to keep in touch with you daily?
Yes.
Are there any other parts of that agreement that...
Raid, would you like any more details?
What do you mean by any other parts of the agreement?
Well, if they have to sign an agreement that they're self-monitoring, I was just trying to get details.
Oh, okay. So the agreement is what we refer to as a self-monitoring agreement or self-isolation agreement, and what that means is that they're agree not to go into public spaces, stay home from work or school, and things like that, which mostly are geared towards the prevention of them if they were happen to be infectious, to keep them from giving it to other people.
Does that have to be reported to the CDC?
The state reports that to the CDC. We pass the information along to the state, and the state coordinates actually the majority of the cases and monitoring.
So are those folks considered persons under investigation? I think that's the...
No, people under investigation fall under a very strict criteria in terms of both symptoms and travel history and testing. So,
Are there any of those here?
no.
The people who are self-monitoring, how were they identified? Did they do that voluntarily, or did you identify them in some other means?
So there's 3 primary ways of us identifying individuals who are who would fall under these criteria. One of them is self-reporting. Sometimes people return and they would call us immediately about it out of concern for their own health. There are sometimes individuals who make it to their healthcare provider because they're not feeling well, and then they disclose that they were in one of those countries 14 days prior. And then the last method is through the CDC and the state. They actually have a list of travelers from affected countries that they then pass down, and we would be tasked with identifying those individuals and reaching out to those individuals to see what their situation is. And depending on details from that conversation, we would classify them based on their risk.
Sir, can we get your name and title, please?
My name is Ray Zhao. I'm the Chief Epidemiologist for Louisville Metro Public Health and Wellness.
Can you tell us how those 10 folks who are self-isolating were identified? Were these folks who came to you guys, or were these folks who the state said, hey, this person just returned, you may want to go check in on them?
It's a mix of both. I would say it's probably even between individuals or healthcare providers calling us saying that they have someone, and the state letting us know that they have had, when they get lists from the CDC, to let us know that we have people in our jurisdiction that they are either reaching out to or they're having trouble reaching out to, and they would want us to kind of go out and reach out. But it's a mix.
And I would say ideally we would have the names of everyone who's traveled, but countries are being added quickly, and so if someone came back in 14 days before that country got added to the list, we wouldn't have their name from the CDC, and those are the ones that are getting self-identified.
We spoke to a hospital earlier today who said they don't currently have the technology to actually test for COVID-19. They have to send their information off to, I believe she said, the CDC in Atlanta. Do any healthcare providers here in Kentucky have the technology to be able to test in-house right now?
Currently, no. Right now, the only lab that has diagnostic or basically determining or confirmatory testing for COVID-19 in the United States is at the CDC lab. They can process about 400 labs a day there locally, not locally, but at the CDC. But unfortunately, we do not currently have the capacity, but the CDC is working on that and working through it and making that information available for all testing laboratories and not just public health laboratories, for example.
Dr. Moyer, are there any, well, we talked about passengers coming to the Louisville airport that are being screened elsewhere. What about UPS pilots?
Yeah, same with that. We're working closely with UPS to monitor anyone who's traveled to any of the countries listed.
So their pilots are monitored or screened before they reach Louisville?
Yeah, they're under the same sort of protocols, watching for symptoms and self-isolating if they've been away.
Their pilots are flying into China on a volunteer basis. Do you know if any of those volunteers live in Louisville?
I am sure some of them do, but I don't know details now.
Of the 10 people who are being monitored, is that in the Louisville metro area or the kind of the greater?
That's Jefferson County.
And in terms of masks, you said that they don't protect if you don't have the virus already. Everywhere is sold out of these masks. Do you think that is just people not being informed of what actually they need to do to protect themselves?
Yes. So the masks are there to help you prevent the disease from spreading to other people, and so that was why I wanted to get the message out today. Yeah.
With Derby being an international event drawing people from all over the world, will there be any kind of precautions taken for the crowds that are coming in and participating in the events here that we can anticipate?
Yeah, we're going to be working closely with everyone to make sure we have those plans in place.
Can you tell me what they might be?
Not yet. I don't know.
No.
Yeah.
We're just
Yeah.
monitoring the situation, obviously taking it very seriously, but it's too soon to say if that will be in place and what the protocols would be.
So just to be accurate here, you do have plans, you don't know if you're going to implement them yet?
No, the plans are not concrete. Obviously, this is an issue of concern that we'll be monitoring. We will have plans if need be, but they do not exist right now.
Because, I mean, the situation's changing every day in respect to the virus, so it's hard to predict what is going to be in place 64
What kind
days
of
from now.
questions are on your mind as the Derby is approaching?
I mean, the issues are like the number of cases, obviously, in time as it collapses in and around the Derby, right? So if we start seeing rapid increase in cases here in the States and we get closer and closer to the Derby, then obviously that means the need for protocols associated with the Derby are going to increase. So we'll be, I would say, in a monitoring situation here over the next week or two. We're all communicating with each other, and so we're in a wait-and-see mode right now. Okay, thanks everybody for coming out today. Thanks to our Public Health and Wellness Department for being ready.